Hello, and thank you for joining the PolicyLab webinar series. As a center of emphasis within the Children's Hospital of Philadelphia Research Institute, our multidisciplinary team of researchers, policy experts, and communications professionals work to achieve optimal child health and well-being by informing program and policy changes through our research. This webinar series is just one of the tools we use to translate our research into evidence-based policy solutions at the local, state, and federal levels. For more about us, I invite you to visit our website, subscribe to our newsletter, and follow us on Twitter, using the information on this slide. Today's speaker is Dr. Brian Jenssen, an expert on youth tobacco use. And tobacco use is truly a youth-based issue, considering 90% of adult smokers started as teenagers. In his clinical practice, Dr. Jenssen develops thoughtful approaches to not only reduce teen smoking, but also help the parents of children and youth achieve smoking cessation. In addition to his role as a practicing primary care pediatrician at CHOP, Dr. Jenssen is a faculty member at PolicyLab, an instructor in the Department of Pediatrics at the University of Pennsylvania, and a fellow in CHOP's Entrepreneurial Science Scholars Program. As one of CHOP's experts on tobacco, one of the most common questions Dr. Jenssen receives is, what about e-cigarettes and other forms of vaporized nicotine? Our webinar today covers the rise of e-cigarettes as a public health issue for children and how pediatricians and others can push for stronger regulations on these harmful products. Following today's discussion, I invite you to visit our website for supporting materials, including a new journal publication describing another emerging tobacco control issue, heat not burn tobacco products. Thank you, and we hope you enjoy today's discussion.
Hello, everyone. This is Dr. Brian Jenssen. I'm a pediatrician and researcher based at the Children's Hospital of Philadelphia and PolicyLab. We'll be talking about adolescents and e-cigarettes, trends and what pediatricians need to know. Before we dive in, a little bit more about me. So I'm a primary care pediatrician, a health IT researcher, and tobacco control researcher. I focus a lot on topics of tobacco, how we can help individual parents and patients, teenagers quit smoking, and then also a lot of public policy work about how we can best protect children and families from the harms of tobacco. Before we start, I want to just make sure I highlight kind of our work at PolicyLab. This is our innovative group here at the Children's Hospital of Philadelphia, in which we're focusing on care for children and families that drives our research to inform practice and policy to improve child health in really 4 key areas. And my research, our work in this space around tobacco use, goes across adolescent health and well-being, as well as intergenerational family services, meaning targeting kind of parents through treatment to help protect their children and families from tobacco use. And the adolescent health and well-being section, what we're really focused on there is coming up with solutions-oriented research that we aim to inform programs and policy changes that ensure all adolescents can receive care to meet their unique needs and ultimately transition to healthy, productive adults. So for today's webinar, I'll update everyone today about the trends in child and adolescent e-cigarette use. My goal is to prepare everyone with the latest health-related evidence regarding e-cigarettes to help address their use in clinical practice, and then finally to provide background to enable participants to contribute to policy discussions regarding e-cigarettes. For our next webinar, before we dive in, other topics that we won't discuss today around hookah, other teen substance use, and the particular harms of mentholated tobacco products. That's for another time. We have content expertise in this space. If you're interested in more information on this, you can always reach out to us and check out our website, the PolicyLab website. So in terms of big picture for tobacco, I always like to remind everyone that cigarette smoking remains the leading cause of preventable disease and death in the United States. More than 480,000 deaths each year are from tobacco. That's 41,000 deaths, that includes 41,000 deaths from secondhand smoke exposure. That's 1 out of every 5 deaths in the United States, 1 out of every 3 cancer deaths. We've made tremendous strides in the adult population. We're down to about 15% of the US adult population that smokes. And those peaked in the 50s and 40s percentages in the 50s, in the 1950s. But that still is 35 million adults over the age of 18 that use tobacco products, in particular smoke cigarettes. And those 35 million adults expose more than 50 million non-smokers regularly to the harms of secondhand smoke exposure. In terms of cost, $300 billion each year are attributed to tobacco. And finally, what I want to remind everyone is this is a horribly defective product. It is addictive by design, and it kills half its long-term users. It's the only product on the market that when you use it as intended, it will kill you. And that's what puts tobacco in a special category and why we need to do a lot to protect families, patients, and adults from these harmful products. Now, I mentioned we've made tremendous strides when it turns in terms of the adult population. So let's talk a little bit more about adolescents and cigarettes. So tobacco use is a pediatric disease. The vast majority of tobacco use starts during adolescence. More than 90% of adult smokers started when they were under the age of 18. More than when you look at, in particular, adolescent tobacco use, more than 60% of high school users become adult users. That's one of the strongest correlations across any sort of substance, stronger than alcohol, marijuana, cocaine. When you use a tobacco product, especially when you're under the age of 13, 14, you are extremely likely, the majority of those individuals go on to be adult tobacco users. And it's important to remember that adult smokers die an average of 10 years earlier than non-smokers. So this is a disease that pulls in children and adolescents and then prematurely kills them. Nonetheless, though, there's some good data in this space, and that overall there's been a very reassuring decline in tobacco use among teenagers. What you see on the graph here, this is data from Monitoring the Future study. The red line represents 12th graders, the blue 10th, and the green 8th, and we've seen a steady decline in cigarette use over the last now 40 years, down to in the single-digit numbers of adolescent users, especially in the time in high school. Why have there been such a significant decline in adolescent tobacco use? Well, there's been a whole bunch of different major public health and government-related actions in this space. It first started with major education campaigns, really kind of pioneered by the U.S. Surgeon General's office, and these have been consistent reports that emphasize the harm of tobacco products, compile all the evidence, and then talk about ways to counteract it. Also, there's been massive kind of legal settlements. The U.S. Master Settlement Agreement helped really kind of draw attention to the deceptive practices by the tobacco industry and then created funding programs to help push back against use. Then in 2009, the U.S. Tobacco Control Act, which pulled tobacco regulation under the purview of the FDA. Also, not to be understated, have been massive public education campaigns, including bans on television advertising. And these public education campaigns, in particular, things like what I'm showing here on the right from the Truth, the American Legacy Foundation, have focused on empowering teens to push back against an industry that was manipulating them, talking to them about the addiction, and empowering them to advertise to others to talk about why it's so important to be the next generation that can be smoke-free. Further, other big kind of areas, other big steps in this space, restriction on sales and marketing to youth, and also state and federal tax laws. So I talk about that. I want you to think about all the major things that have been done around the tobacco space to really help reduce tobacco use and protect children and adolescents from that. And when we talk about e-cigarettes, you'll see how some of these things are missing right now. Before we dive in, just a little update about the current FDA landscape and their regulatory environment for tobacco products. So I mentioned the Tobacco Control Act in 2009, which created the Center for Tobacco Products. And back in July of 2017, they made a significant, large announcement talking about a new approach to addressing the enormous toll of smoking. They wanted to focus on nicotine reduction in cigarettes, which could be a real big pathway to help reduce tobacco use and then tobacco addiction. They also talked about harm reduction and the potential use for alternative tobacco products. And there's an ambitious plan with a lot of positives and a lot of negatives. I like the quote that they highlight here is that nicotine, while highly addictive, is delivered through products that represent a continuum of risk and is most harmful when delivered through smoke particles and combustible cigarette. So they talked about ways that we can potentially reduce nicotine. What was absent from this was they decided to push off regulation of e-cigarettes, which we'll talk a little bit more at the end. Right now, there is no federal regulation of e-cigarettes. That could have happened as of 2018. Instead, they decided to delay that for 4 more years to 2022. And one more point on this slide in terms of harm reduction products. There are new products that are coming onto the market potentially that are currently under FDA review. And that includes heat-not-burn tobacco products. Those are tobacco products that tobacco companies are advertising to be products that are safer alternatives to cigarettes. It turns out that may not be the case based on independent evaluation. We have a commentary on this topic coming out today, December 12th, on heat-not-burn tobacco products that will be published in Pediatrics. So let's dive in further and talk about the rise of e-cigarettes and the description of these products and the marketing. So tobacco use, the most recent data now shows that electronic cigarettes, and this is as of 2014, now represent the #1 tobacco product used among high school students. 11% of high school students in the last 30 days have used an e-cigarette product. That's much higher than cigarettes, which still is at 8%, and other products including cigars, smokeless, tobacco, and hookah as well. But that represents more than 1.6 million high school students are using e-cigarettes regularly. And when you extend that to middle school students as well, it gets up to more than 3 million individual middle school and high school students. And when we focus in particular about kind of the trends of this use over the last 5 years, so to orient you to the slide, what this shows is the same sort of database compiled over the last 5 years from 2011 to 2016. And what you see, there's been this dramatic rise in e-cigarettes. These products really came onto the market in 2006, 2007, really weren't there until 2011 when we started to see a significant rise. We saw a dramatic increase, and what was kind of very nervous to the public health community, we kept seeing a dramatic increase. And finally, last year was the first time we saw a drop in e-cigarettes. The concern is, and we're going to talk more about this, is what is the relationship between e-cigarettes and cigarettes? What you've seen here is we've seen a steady decline in cigarette use during the same time period, but that started to plateau, and the rate of decline has not gone down as much recently. And the concern is, do e-cigarettes have some sort of connection to tobacco products? Do they, for example, increase the risk if you use an e-cigarette product to going on to use a traditional tobacco product like cigarettes? We'll talk more about that towards the end of the presentation. So what are e-cigarettes? They're handheld devices that produce an aerosol that are inhaled by the users. They often contain a solution of nicotine, flavoring chemicals, propylene glycol, and other. And I emphasize other because there are often these other components that are either unadvertised or unknown to the users. In addition to being called e-cigarettes, you might have heard this other terminology. They're called e-cigs, mods, e-hookah, vape pens, tank systems. They're also called from the medical community electronic nicotine delivery systems, ENDS, as well as a whole bunch of these other products. What you're seeing on this slide is kind of the second and third generation of these products that most often look like tank systems. So that's what I typically see when walking around major urban environments, these tank systems. The picture on the bottom was the second generation device. Originally, these looked like cigarettes, and they've transitioned to look more like these kind of high-end tech devices. So for example, we have these are just kind of called out the wide range of what they can look like. E-pipes and e-cigars. The large-sized tank devices are the ones that we most often see. And then you still see some of the medium-sized tank devices, rechargeable e-cigarettes, disposable e-cigarettes. Again, they're more likely these large-sized tank devices rather than these disposable e-cigarettes. This gives you a sense, two things on this slide, talks about kind of the flavoring. One, what typically happens, you take these flavoring, you buy them independent of a device, and you add them to the device. But I'm calling out, these are most often the flavors that you typically see. And you don't need to be a pediatrician to realize that these flavors are intentionally enticing towards children, adolescents, and young adults. Flavors like bubblegum, chocolate, cotton candy, grape flavors, and gummy bear. These are the flavors you typically see, and these are flavors that are known to be attractive to children, adolescents, and young adults. You take those flavors and then you add them to the particular receptacle container for this solution. And I'm showing you just 3 different examples. These particular slides come from the recent well-researched and very comprehensive report from the Surgeon General's office on e-cigarette use among youth and young adults. And this just gives you a sense of this almost kind of individual feel for that. You buy these flavoring chemicals, you can add them to your own compartment, you can mix and match all these different chemicals, which has been a draw for people. They feel like they can take control over what they're smoking. Meanwhile, what they're using is often unclear. These products, again, as I mentioned before, are unregulated at the FDA level. So there's a whole bunch of other things besides just the flavorings that are advertised in these products. Now here, what I'm showing is the dramatic prevalence of various vape shops throughout our particular catchment zone. So there are 2 pictures here. On the right is our CHOP Care network. All are over 31 pediatric practices in eastern, southeastern Pennsylvania and New Jersey. And there are, on the left, is the image of all the different vape shops just across a Google map for the same area. And there are over 120 vape shops near our patients. This shows you how widely prevalent this particular issue is. Now, what we've come to identify is that e-cigarette companies are targeting children and teens with their advertisements. They're using youth-targeted channels like television, point of sale, magazines, promotional activities, and social media. And just like tobacco companies before, e-cigarette companies are using key themes that are known to be effective in traditional cigarette use, advertising and promotion to draw teenagers into using these products. And those key themes include sexual content themes, customer satisfaction themes, the idea of freedom, free to smoke in certain environment. They include unique flavors that I mentioned before, kind of attractive to children and adolescents. They're confectionery in nature, things like vanilla cupcake, maple pancakes, and there has been consistent evidence that shows that the use of, in particular, these key themes, but also these unique flavors, are known to encourage youth experimentation, regular use, and addiction of tobacco products, including cigarettes and e-cigarettes. Now, there's been a rapid rise in marketing during this time as well. Over the last 6 years, there's been a dramatic increase in the quarterly promotional spending on e-cigarettes. And really what you need to see on the slides is dramatic increase. Now, as of the most recent data of 2014, there's been over $125 million spent across all these different media just for e-cigarettes, and more often than not, in markets that are targeted towards children and adolescents. So now I want to just give you some specific examples showing you about these marketing claims and these key themes. And these pictures are important because they're targeted towards not so much us, the particular viewer of this webinar today, but really targeted towards children, adolescents, and young adults. So these ideas of freedom is a key theme. Take back your freedom. The idea being that you could potentially smoke these. You can't smoke cigarettes in public places anymore, but maybe you could smoke these e-cigarette products. We'll talk about how there's still harmful chemicals in these things, and there is secondhand smoke exposure. But early on, before there was regulation in the space and education about these harmful products, they were arguing that you can be free to smoke these products around other people. Romance and sexuality. This has been used by tobacco companies over the last 60 years, and e-cigarette companies are doing the exact same thing. This idea in this space of unregulation and misinformation, the idea that e-cigarettes could help people kind of choose a healthier tobacco product or even help with smoking cessation. We'll talk about how the evidence doesn't support that assertion. Also, taste and product. Some choices are hard, as this ad says. This is easy. So they're talking about comparing. You could have, rather than have your decadent cupcake, you can get the same flavors through your e-cigarette product. And then, as I mentioned earlier about freedom, bypassing the smoke-free laws. Another example, here's a person who's smoking on a plane, which quickly, as I think anyone that's traveled on a plane recently realized, that these have secondhand smoke emissions and they've been banned from their use in the planes. But early on, they would talk about bypassing these smoke-free laws. Now let's talk about the kind of ongoing research and the communication gaps in this space. So the key first message here is that nicotine harms the developing brain. Nicotine exposure, regardless of the form, is highly addictive and harms infants, young adults, and adolescents. During adolescence, it really seems like it can increase the risk of addiction, especially early on. As adolescent brain development, more and more research suggests adolescent brain development is still occurring up until the age of 25. That developing brain is particularly susceptible to any sort of products that could increase the risk of addiction. Further, not only is it harming adolescents and young adults, but during infancy, that same nicotine content can cross the placenta and has known effects on fetal and infant development, especially lung development and brain development. The next one is about e-cigarettes and secondhand smoke. What's clear? So in the secondhand aerosol, it is not harmless water vapor. That is clear. Early on, these products, people will say these are just harmless water plumes that are being emitted by these products. Well, it's pretty easy to get a hold of these products and then test them in a laboratory environment. And what we've identified through consistent research is there is known harmful toxicants and carcinogens found in these emissions. And that includes the same things that we worry about, the same things that cause lung disease, lung cancer, and heart disease from cigarettes are in these e-cigarette emissions. And that includes heavy metals, formaldehyde, and nicotine. There's also new emerging evidence about the direct harms on immediate health. And so we'll focus a little bit on e-cigarettes and asthma. The tough thing when you look at these tobacco products, there's minimal evidence from epidemiologic studies on e-cigarette use and adolescent health indices. It's hard to study adolescents, and you need time to investigate new products that come on the market. If something takes 5 years to lead to a worsening health outcome, you typically need at least 5 to 10 years to kind of start to identify that and leverage the appropriate resources to study it. Over this period of time, there's been growing kind of evidence that e-cigarettes have adverse effects on lung health immediately to the individual adolescent adult users. there seems to be an odds of asthma increase by about 50% among adolescent e-cigarette users. And in these studies, which I highlight at the bottom, they've controlled for cigarette smoking and other risk factors. And it seems that e-cigarettes have their own risk profile separate from or on top of cigarettes. So it's not just about kind of some of the long-term consequences, there are immediate health harms from use of these products. Now, this is the biggest concern, and this is what we focus the most on right now. And there's the most evidence on this space now. E-cigarette initiation and the risk of subsequent cigarette use. There has been remarkably consistent studies that have found there is a clear progression from e-cigarette to traditional tobacco use. There are 8 now separate, well-designed long-term studies that show that adolescent e-cigarette users are at higher risk of transitioning to traditional cigarettes compared to non-users. And this is for otherwise low-risk teens. And what I mean by that is they're controlling for other risk factors, things like socioeconomic status, things like risk of depression, mental health, that would often draw people towards tobacco products. Controlling for that, teens who are otherwise not at risk for using traditional cigarettes are using e-cigarettes and then transitioning to tobacco products, cigarettes. And what gets everyone concerned about this appropriately is these products have the potential to addict a new generation to tobacco, addict a new generation to a long-term health cause and death from using traditional cigarettes. Another big health-related issue is the potential role in these products, in e-cigarettes, in helping adult smokers quit. Currently, e-cigarettes potentially having the impact on smoking cessation is not supported by the scientific evidence. Studies of the relationship between e-cigarette use and smoking cessation have found kind of really mixed results. 20 have showed reduced quitting, meaning that they actually decrease the likelihood to go on to quitting. 8 have showed improved quitting. And what that shows is that some studies suggest maybe this could be beneficial, other studies suggest not. What seems to be the trend, though, is that individuals who use e-cigarettes in the hope of helping them quit smoking, more often than not, they're still smoking traditional cigarettes at 1 and 2 year follow-up. Now, if there's something that can help people quit smoking, I'm all for it. That could be such an effective way of helping reduce not only adult users' long-term health risk, but also protecting the health of the family and the child. But right now, if we're helping individual adult smokers quit, which is an area that I focus on, instead of connecting them with something that we're not sure that has any sort of benefit and might actually harm them, we have a whole bunch of things that are known to be effective in helping adult smokers quit. And that includes nicotine replacement therapy, prescribed medications like the patch or gum. For adults, there are 2 pharmacotherapy options, including bupropion, Zyban, and varenicline Chantix, that have been shown to really help improve smoking cessation quit rates. And there's also a whole bunch of behavioral counseling tools that are available to adult smokers, including the Quit Line, which is free, available throughout the United States, and available 24/7. So when a cigarette user comes to a physician and says, I'd like to use e-cigarettes to help me quit, what I usually say is, that's great that you're trying to quit. We don't know about the potential benefit of that product. Why don't I connect you to products that we know are much more effective in helping you quit? And usually when I talk to patients about that, they are grateful that educating about that e-cigarettes may not actually help them quit, and that they get connected to resources that are shown to be effective. In the pediatric clinical space, screening for adolescent cigarette use, it's tough to tease this out right now. On population surveys during the past 30 days on how many days you use electronic cigarette or cigarettes, that seems to be the kind of the best way of asking about this so far. Probably the better way of doing that is also including a paragraph beforehand that explains about these products. In the clinical setting, it's really rare to actually screen for e-cigarette use right now. Pediatricians feel poorly informed about it. They're unsure of the effectiveness of the recommendations. And the typical barriers we see in screening for substance use are there for e-cigarette use. There's lack of systematic screening, a whole bunch of different competing priorities. So what we're focusing on is actually these research gaps here at PolicyLab and the Children's Hospital of Philadelphia. We're trying to get a better understanding of the frequency of use, understanding why teens are using these products, what's drawing them to them, and also trying to understand what is the content of these products. Do teenagers who use them really understand what's in these products? As I mentioned before, there are a whole bunch of content in these solutions that are known and unknown to the users. And what other substances might they be using along with these cigarettes? For example, could they be using marijuana in some form through their vaping device? The last thing we're focused on is now the clinical and policy recommendations in the space. So the first thing is the Surgeon General report. And what it really highlighted was the role of the pediatrician. The Surgeon General report came out in 2016, and it talked about what they continuously identified in talking to teens and parents and kind of combing through the literature, they found that pediatricians remain a trusted source of healthcare advice for parents, children, and families. And it's important to recognize that we are uniquely positioned, pediatricians, pediatric healthcare providers, are uniquely positioned to advocate for our teens, to ask them about tobacco and e-cigarette use, and then give them strong messages about if they're not using these products to stay smoke-free, and if they are, to hear from us that I'm concerned about that. There's strong data that shows that this could worsen your long-term health. So let's talk about some examples of what could be some conversation with patients. And I've taken these from a combination of sources, including the Surgeon General report that I recently mentioned that came out in 2016. And so here are some questions and answers that could be helpful in your particular clinical space, whether you're talking with a patient in a clinical context, talking with families, or just advising other pediatricians about the dialogue they could be having with their patients. So what are the risks of e-cigarettes, an adolescent could ask? Well, we can say there are unknown harmful things in these products, including nicotine. Nicotine is the addictive product in tobacco that leads towards a lifetime addiction. E-cigarettes are strongly associated with going on to use traditional cigarettes. We want to make sure that people don't use those products. Another question one might get asked is, my friends use e-cigarettes that don't have any nicotine in them. Then these aren't harmful, right? Well, nicotine is very common in e-cigarettes, and e-cigarettes may not be labeled to accurately show their ingredients, but there's no, right now, federal regulation to label them. So it's unclear, maybe nicotine is in those products. We want to emphasize nicotine is very addictive and can harm your brain. Another question, I thought e-cigarettes were used to help people quit smoking. The evidence isn't clear on whether e-cigarettes can help people quit smoking regular cigarettes, but we already know that e-cigarette use is a health risk for young people. For example, nicotine can harm your brain development, and your brain continues to develop up until the age of 25. Another statement is, I've heard e-cigarettes are less harmful than regular cigarettes. Well, this one is kind of, from an evidence standpoint, is hard to tease out right now. We don't have that much evidence around the long-term health impact, so we don't want to overstate some of the early findings. So what I find, what you could say is, they may not contain as many dangerous chemicals as cigarettes, but that doesn't mean they're safe to use. Many of the chemicals in e-liquids and e-solutions and the aerosol from e-cigarettes are known to cause cancer in humans. For the last conversation point, a patient might say, there's no smoke in e-cigarettes, they're just harmless water vapor. Or you might even have kind of friends or colleagues or others that make this same point. The most important thing to emphasize here is that's not true. The emissions from these products is not harmless water vapor. The aerosol that's created when an e-cigarette heats up the e-liquid is not just water vapor, and is not harmless either for users or for others who are exposed to it secondhand. Besides nicotine, which is harmful to young people's health on its own, there are these heavy metals that can cause respiratory distress and disease, have been found in e-cigarette aerosol. Chemicals that are known to cause cancer and that have been linked to lung disease can also be present in e-cigarette aerosol. If you need a quicker statement, you can often say it's almost like the same secondhand smoke coming from cigarettes. It's not harmless water vapor. And when you're having conversations with patients, it's important to understand what are the available treatment options. There are a variety of effective prevention and treatment options. The problem is they're underutilized. There are these great educational resources. There's also remote counseling through the Free Smokers Quit line. There's also text messaging and smartphone-based apps. If you have a teenager who's interested in quitting, whether it be a tobacco product or interested like traditional cigarettes or new tobacco products like e-cigarettes, you can connect them to the smokefree.gov website or smokefreeteen.gov, which can help them connect to the main resources that have been shown to be effective in helping teenagers quit smoking, including the counseling quit line, the Free Smokers Quit line, Smoke Free Text, and the smartphone-based apps options. All right, now we're going to close with just some kind of policy updates in the e-cigarette space. Well, I mentioned at the federal level, these products are not being regulated right now. That doesn't mean that we're not having tremendous positive strides at the local and state level. That includes incorporating e-cigarettes into the same smoke-free policies that apply at the local or state level. What I mean by that is saying that just like you can't be the smoke-free laws that say you can't be using cigarettes in certain environments, that applies to e-cigarettes as well, because we know that the emissions from these products are harmful to children, adolescent, and adult health. There's also big initiatives to prevent access to e-cigarettes by youth, making sure that we're restricting the sale of the products, increasing the purchase age, including that for e-cigarettes as they are for cigarettes, 18, and now the new big national push to increase purchase age from 18 to 21. In terms of price and tax policies, these are starting to be taxed at the local and state level. It's a little difficult to how do you price. Right now, we have good evidence to show how we tax cigarettes. It's taxed at the individual, essentially box or carton level. For e-cigarettes, it's harder because you typically buy the product and then buy your own solutions. So it doesn't mean that local groups aren't coming with innovative ways of doing that. For example, in Pennsylvania, they're being taxed at the supply level of the total product, meaning that if you have in inventory X amount of solution, that's going to be taxed at the individual proprietary level. There's also regulation of the marketing, making sure that we're restricting advertising of e-cigarettes, just like we're doing restrictions for traditional tobacco products, and then larger educational initiatives. Now, on a national level, the FDA was set to regulate e-cigarettes just like other tobacco products in August 2016. In August 2017, they decided to delay that regulation up until 2022. So this product will remain unregulated at the national level. I think that's really important for people to realize. Right now, we talk about looking at labeling for these products so people understand there are no labeling. There's no national regulation. There's no regulation of the quality control of how these products are produced and how they're actually used and what's actually in them. There are large education campaigns, and the FDA has initiated one of them to make sure that they're educating on a national level families, adults, and children and adolescents about the harms of these products, including emphasizing that e-cigarettes could be strongly associated with transition to traditional cigarettes. If you're interested in more information on this topic in particular, around the FDA and the regulation of e-cigarettes, we have a health affairs blog post that I'll direct you to that came out in August 2017, and we highlight that here. So let me just close by saying that we've gone through kind of the big picture around tobacco and adolescent cigarette use. We talked about the rise of e-cigarettes, highlighting the products and the marketing of them. Talked about the ongoing research and communication gaps. And then we closed by talking about the clinical and policy recommendations. With that, I'll leave it to say, if you have any questions or comments, please email us at policylab.webinars@gmail.com. Thank you for your time today. If you have any more interest, just reach out. Thanks so much.